I have children at home. I have 4 of them, so that's the 5th one. And it's first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarong Par Village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it's strange from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had a face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works. So we input the information quicker and you don't have to do multiple copies in order to share to the different wards.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good, yes.
Yes. So I could feel my babies really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.